Mix of, going through treatment on top of all of this. So it was hard.
Did you try any other more traditional established forms of mental health treatments?
I had gone to therapy a handful of times. I had been on antidepressants for 4 years, and those helped to an extent. It got to the point where I'd rather find something natural than take more pills. They say that even after the dosing and after you're out of the trip, that your brain is still, very active.
Even holding the baby, he's like, we're just trying to figure this world out together.
I was like, I understand. I was like you in my journey. I'm gonna hold you, and we're gonna get through this, man. We're gonna get through this. And he stopped crying. He stopped crying. The hardest part was I had one vision where my wife and my son had just woken up, and my other kids ran into the room, and I was dead on the bed. And I guess it's something that I never wanted to visualize. It's something that I guess I had been putting off for, the fear of. But in a psilocybin trip, you can't control it. So I saw it. I went through it.
You feel like it's given you a quality of life?
I stopped living with the expectation that I'm going to wake up the next day. And in that, I've just learned to appreciate every day. So just appreciate every moment.
Psilocybin treatment isn't just promising for cancer patients. Trials suggest it has the potential to treat a range of mental health issues, including mine. I've struggled with depression most of my life, but when my mother died at the height of the pandemic, suddenly the antidepressants and talk therapy I'd always relied on weren't really cutting it.
I'm so glad Grammy passed away.
I started looking into high-dose psilocybin therapy as an alternative when a friend recommended it. Coincidentally, around the same time I began reporting on this story. And now I'm planning for my own experience. The treatment isn't legal in the US, but there is one psychedelic that is.
Hi. Hi, Josh.
This is the form of ketamine approved as anesthesia, but it's also used off-label by doctors as a treatment for depression.
The way in which I practice, unfortunately, is very expensive. I do long sessions, typically 3 hours. When I'm working with someone in ketamine-assisted psychotherapy, sometimes there's preparation and there's a lot of integration afterwards. How are you doing?
May I have some of that?
So good.
Oh, wait.
So why don't you slip on your mask?
Person who traumatized me.
What I found with ketamine, different from anything else, was it was an exploration of mind. It was the closest thing I'd ever experienced to the highest levels of meditation that I'd heard about. When you're done and your mind clears, what you feel like is as if someone went into your brain with a sponge and cleansed you.
Most versions of the drug aren't covered by insurance, and neither is the therapist's time. Dr. Geeta Vaid charges up to $600 an hour. Psilocybin therapy could end up being equally expensive. There's an argument out there that people have been using psilocybin for centuries outside of a medical setting without trained medical professionals. Why do we have to medicalize it in this way, which is going to cost so much?
Usually there's shamans or priests who are holding the knowledge. It's rarely everyone just can have access and do it themselves. There are a lot of kids who are using all of these medicines recreationally in all sorts of contexts. And it's not clear to me that overall they're more enlightened. So even the idea of why don't we just make them accessible and distribute them, to me, it doesn't seem convincing, at least, that that is a path towards overall health and benefit.
I'm preparing for my own psilocybin experience, and I wanted to talk to a psychiatrist. And I have pretty good insurance in America, and yet, for the initial consultation, it was $600.
Mental health coverage in America is quite challenging, right? I mean, even forget about psychedelics. Insurance coverage is not great, generally speaking. And then a lot of doctors don't accept insurance. I think psilocybin is going to be obviously a different challenge because it's such a longer acting substance. It does then require longer sessions.
Real benefit, and that's
right now, pharmaceutical companies, non-profits, and state governments all have different visions for what psilocybin therapy could look like. Shayla
How's
Love
that?
has been reporting on how it's being
Senate.
folded into the American healthcare system.
If you are somebody who's covering mental health, neuroscience, psychology, psychedelics became an
friends on that.
inescapable topic several years ago.
If we look at other maybe examples like ketamine therapy, where it's not very well covered by insurance, what's the future looking like? Is it going to be able to be affordable? How can we make it more accessible?
This is a huge question and one that I worry about a lot, which is if this is as revolutionary as people say it is, anybody with a mental health issue deserves to be able to try it. We've never tried to make a mental health treatment like this available before, which integrates both
Shouldn't
a
we?
very extensive psychotherapeutic piece as well as a drug. There are several clinical trials that
But you know what? It's a good thing that all those old brains and those old people who are stuck in a different mindset are on the way out now. So pretty much people, right, from 70s and 80s, almost even 80s. I mean, I'm almost 40, so people from the 80s are probably in the mental health care system, in this sort of system. So perhaps it will be changing, or it is. I mean, changing for the good, you know? That nuclear age family is maybe on the way out the door finally, you know? Unfortunately, a lot of our mothers and fathers and
are collecting data
grandparents
to present
went through that, and we experienced it in our own way. But perhaps our generation is finally going to be able to change this stuff.
to the FDA to try to get psilocybin approved. At the same time, there are movements to pass laws in states to get legal access to psychedelics. So in Oregon last November, Measure 109 passed, and that sets up a plan for within 2 years, by 2023, anybody can get a license to perform psilocybin services in Oregon.
Home to some of the world's loudest psychedelic advocates, Oregon has long been a mecca for psilocybin, even while mushrooms are still a Schedule I drug.
Oregon has become the first state to allow facilities to administer that psilocybin treatment, passing with 56% of the voters saying yes and just 44%.
Measure 109 passed in
I
2020.
mean, that's cool.
Measure 109's regulations require psilocybin only be used by adults in licensed clinics supervised by
I mean,
trained
that's just, it
facilitators.
should be an option.
This is very different from the medical model. Instead, Oregon's new law skirts the federal approval process.
I think it's up to the states too. Like, I mean, you can still get. I think Maine. Yeah, I think Maine. Mushrooms are a misdemeanor. Maybe, I don't know.
And the state will regulate how and
Yeah.
where people can get mushrooms.
It is 1
We
o'clock.
have
An advisory board made up of doctors, lawyers, policymakers, and experts in the field is trying to tease out the details.
This is a whole new paradigm, and the facilitators are the backbone.
Mason Marks is a senior fellow on psychedelic law and policy at Harvard.
In Oregon, we're very careful to call this psilocybin services and be clear that it's not a form of therapy. So if someone is administered psilocybin, the facilitator is there to just make sure that they are safe and everything is going according to plan.
Whereas what?
One of the goals here
That's
is
the same
access.
place
You won't need a prescription to qualify.
Isn't that the same place like where heroin users, like in New York and stuff, can go use their drugs, but just also be safe? I don't know if it's in New York, but I think there were things that arose in the past few years of those sort of areas, but I think they were opposed by, I don't know, Senate people or, you know, the Whigs.
for psilocybin services. Is there a risk
But Canada-
that some
Canada
of that
supports this
spirituality will get lost?
For us.
Or is it a necessary sacrifice to get this out to the most people possible?
Measure 109 was trying not to create a medicalized model because there is so much ownership of medicine in this culture by a certain group of people.
Angela Carter is a naturopath and the board's vice chair. They're dedicated to making this therapy safe and available to everyone who wants it.
We are in the middle of late-stage capitalism, and we have to work within that framework, and also at the same time try and shift it. And I feel like psychedelics have a really good potential for creating that shift, as long as we start off well and do it right the first time.
Yeah. And
it is true that, of course, psilocybin is a Schedule I controlled substance, and that means that, according to the government, it has no currently accepted medical use and high potential for abuse. The evidence just does not support the categorization of psilocybin in Schedule I.
What limitations, if any, does that put on things unfolding here?
There hasn't been a lot of dialogue with federal agencies about that. But they tend to take a very drug development approach to psilocybin, and what we're doing here is very different.
For now, pretty much everyone else is going with the drug development approach, which means trying to make psilocybin a prescription medication. There are only a handful of places in the world that make medical-grade psilocybin, and this is one of them. The USONA Institute believes in open science. So they make their research available to anyone who wants it, and they offer their psilocybin for free to clinical trials.
Nice. I sign up for that.
Purified crystalline psilocybin. This is what psilocybin looks like at the last step of the synthetic process.
Not feared every day.
There are different ways of getting this to market. The for-profit route, like biotech and pharma companies. And then there are the organizations that claim they want to put their mission before profits. Can you tell me what USONA's commitment to open science means?
You make available your findings in ways that would make it harder to get intellectual property or to patent something. So it's essentially a commitment to share our discoveries with the world so the best use can be made of them. We'd like to see the sort of heritage molecules, the molecules that are either directly derived from plants or that have been in the world for quite a while, or that were previously developed as pharmaceutical things like LSD perhaps, or certainly psilocybin, which we work on, to be available in an open space.
With all the private sector interest, most non-profits aren't able to compete. But USONA can, partially by hosting mega fundraisers with mega donors.
This might be a slow burn.